Hey everybody, Dr. Rob Silverman here, Amazon best-selling author of Inside Out Health. Excited to be sharing a Monday afternoon with you. So today, I was so busy last month with webinars and full of inquiries and great questions. So I wanted to open this up and just say, anybody who wants to ask a question, go for it. Put it right up there. I'm going to answer it. We have some questions here that I've already had that I think are some of the better ones that I would love to recommend and go over with you. So number one is immune support. Someone said, hey, you've been talking a lot about COVID-19, a lot about immune support. And it's interesting in that, could you share a protocol with me? Could you share the idea of what's going on? And without question, I'm happy to do that. Just initially, I just would love to be able to go over the concept of immunity with everybody. So many people are asking, so many people are interested in immunity right now. And what's most interesting about the immunity is people have a little difficulty in going through the idea of the immune system. So the immune system has three basic parts. It's got the skin, as you've heard me say before. The skin actually protects the body, as we all know. The skin, more so than that, also is an absorber. So you don't want things to pierce the skin. It's your first barrier. When you add into the idea that your stomach acids and digestive enzymes are also part of your immune system, you begin to realize why, as I've said before, 80% of your immune cells are in your gut. But the two parts that I really want to talk about are the immune system, what we call the innate and the adaptive immune system. The innate immune system everybody has when they're born. It protects you against foreign bodies, injuries, and different pathogens. It's actually bacterial killing substances occur there. It's protection on the outside. It works in sync, if you will, with the skin. It also allows that protection on the inside that we just aforementioned, which is all the mucous membranes, and is without question the first to attack in the tissue. So I like to refer to them as scavenger cells, Marines. They come in and they destroy everything. The second part, your adaptive, is specific against pathogens or changed body cells. You will have these defense cells in your blood, which are T and B cells. T cells come from your thymus, B cells come from your bone. They are recognize B and memorize your antibodies, which are your IgE, IgM, IgA, and they are critical elements. They actually produce these antibodies. And this is the whole idea that with COVID, do you have antibodies, a vaccine? Do you produce antibodies? But what most people wanted to know is the micronutrients and the macronutrients against COVID-19. So the micronutrients, more so vitamins and minerals. Let's go through some of the minerals. Zinc. Zinc is a great mineral. I recommend it. Some of the things that zinc is good for is great for retaining your smell. So if you've lost your smell post-COVID, zinc and alpha lipoic acid. Zinc is an antioxidant. It halts the replication of SARS-CoV. It targets what we call the ACE2 receptors or SARS-CoV-2. Iron, we don't talk about iron enough. Iron actually activates the immune response by cytokine production. Selenium, actually has strong antioxidants. A lot of data indicated that the decrease in selenium increased the incidence of COVID-19. Vitamins, and I keep it very basic when we talk about the vitamins. Vitamin A, actually anti-inflammatory, antioxidant. Vitamin B stops the replication of SARS-CoV-2, anti-inflammatory. Vitamin C, another great antioxidant. It was considered so potent. Last year, a lot of medical emergency room doctors were actually adding vitamin C in an IV, 1,500 milligrams 3 to 4 times a day. Vitamin D, we could be here all day. Vitamin D is an antimicrobial. Vitamin E is an antioxidant. So when you look at that, you understand that we've got 5 or 6, many more, but we have about 5 or 6 main go-to basic vitamins, 3 basic minerals. Now, when you break it down into the immune response, what's most interesting is that the immune response with that innate and adaptive, one key element to what we call that adaptive immune system. The immune system works aberrantly, leads you down a path of autoimmunity. So your innate immune system, the biggest thing is you want to quelch or vanquish, if you will, your immune inflammatory response. And you can do so once again with vitamin A, vitamin C, vitamin D, zinc, and omega-3 fatty acids. The adaptive immune system, again, also works, has different properties. However, vitamin A, C, D, and zinc work really well. But the switch from omega-3s is to pro-resolving mediators. These pro-resolving mediators, for me, are fantastic in they allow the function of inflammation. And at that point, with your adaptive immune system, you want to resolve the inflammation. Certain studies showed that the administration of pro-resolving mediators decreased pro-inflammatory cytokine and chemokine expressions. Also, to break it down and get a little more granular, SPMs or PRMs can turn off virus-induced inflammation. These resolvents actually stimulate the macrophages, which mediate the clearance of cellular debris. So for me, once again, the term I like to use is inflammation resolution. They actually have antiviral activities, and they're also known to promote antiviral B-cell antibodies and lymphocyte activities. A couple other things that I wanted to share that I didn't mention, maybe they didn't gem, melatonin. Melatonin in a Cleveland Clinic-led study was shown to decrease 30% the likelihood of testing positive for COVID-19. Melatonin has some interesting functions in that it bursts and enables the immune system to be more potent. It regulates mitochondrial functions. It has tremendous anti-inflammatory properties, antioxidants. It also helps with sleep, as we all know, and it have a relation to the circadian rhythm. So if you were to break melatonin down, 3 things that I would tell everybody is it's great for sleep. It also decreases that proverbial cytokine storm by decreasing a lot of inflammatory markers like all your interleukins and your TNF alpha. It also stops an overrise, if you will, of an immune response, and it's great by decreasing oxidative stress. So, interestingly enough, that was a more lengthier question, but people always ask about stuff. Hey, Jared, I was reading your mind. How about melatonin for immunity? You got to give me another one. But I got the melatonin for immunity. So here we are. But what I do also have is another quick question that's a good work. Thank you very much. I appreciate that. If anybody, again, has any questions, here's your time to ask me. We've got the staff looking at them, and I'm happy to share. The second question was, and this is interesting, several people have asked me this, and I'm looking at the questions over here. My daughter is pregnant and has COVID. What should I do? Now, with that all being said, I am truly sorry to see that your daughter has COVID-19. There's only so much you can do in reference to within pregnant women. We're not allowed to introduce new things and things like that. But essentially, they were asking, what can they do and what about the baby? Well, what's very interesting, there were studies, and these studies just came out at the beginning of this year. Studies reveal that women not only transfer antibodies to their baby, they also transfer more antibodies to the babies if they're infected early in their pregnancy. For patient study, 83 people had COVID-19 antibodies after birth. 72 babies at 9 tested positive for COVID-19 antibodies via their cord blood, regardless if the mother had symptoms. 50% of these babies had antibody levels as higher than in the mom's blood, and about 25% antibody levels was almost 2 times higher than the mom. What was truly observed is the longer period of time between the start of pregnancy in a woman's COVID-19 infection and her delivery, more antibodies were transferred. Antibody, IgG, it crosses the placenta. So the 2 big antibodies when you talk about COVID-19 is IgM and IgG. IgM comes out at the beginning of the inflammation or the infection. IgG usually comes out somewhere between day 14 and day 28. IgG is 75% of immunoglobulins. It's a critical immunoglobulin because that immunoglobulin is what blocks and docks on top of the cell, not allowing the spike protein to get in. Now that we covered that, IgG also is about 75%. So what you're seeing here and delving in pediatrician's pond, we're seeing that IgG and the baby gets all these antibodies from the mom. Children and antibodies. Children typically are infected with the coronavirus, do produce a weaker antibody and fewer of them than the adults do. Interesting that adults make several different antibodies. but the children make that one specific IgG. So these are children. And this is part of the reason they don't have as much symptomology. These are not the unborns yet, if you will. So another question that a lot of people love to ask me, and then I'm going to go back and look at the list, is they know that I do the laser. So I work for Coney. Everybody knows that. I gave about 3 webinars last week. The violet red light laser. The red light is a 635 nanometer wavelength. It's a modulator. It increases energy flow and dissipates energy too high. It actually promotes and increases energy through the stimulation of the mitochondria, ATP oxygenation neurotransmission. The red 635 has an anti-inflammatory effect. It enhances ATP production, protein synthesis with pain reduction. It also creates an improvement in collagen formation and wound healing. It leads you down the path of reducing pain, muscle spasm, while increasing strength and range of motion. It balances the parasympathetic nervous system and also enhances microcirculation of the blood and lymph and allows for the balance to cell communication. The violet light, antimicrobial, antipathogen, stimulates more sympathetic nervous system, helps the body's defense mechanisms eliminate bacteria, viruses, fungals. And what I like most about the violet light is that it works with the fascia of the body, and more so with the fascia of the body. It allows with fibromyalgia to have better outcomes. The combination of the red and the violet light, and I'm going to get to all your questions coming up, the combination of the red and the violet light actually balances the autonomic nervous system. Dr. Wark, how are you? What do you consider the largest risk factor for poor outcomes or more severe cases of COVID-19? Great question. The risk factors, or if you will, these comorbidities, are the 2 biggest ones for me would be body weight, obesity, i.e. visceral fat, and blood sugar. Elevated blood sugar, insulin levels. We call that diabetes. There's a direct obesity to diabetes link. This poses a major issue. The heavier we are, the more inflamed we are. Fat cells. So the bigger the reservoir, the more toxins we have. There are more ACE2 receptors on fat cells than on virtually any other part of the body, especially more than in the lungs. And the fat cells are reservoir for the viruses to lay and replicate. It poses an issue. Blood sugar means that you're inflammatory. You're seeing a lot of issues with blood vessels, and that is pointed towards what I like to refer to as pre-inflammation. 94 to 97% of people who go to the hospital who died were pre-inflamed. 42% of Americans are obese. 75% of Americans are obese and overweight, and only 12% of Americans are metabolically healthy. So we have a metabolic issue, and that metabolic issue comes from high blood sugar and body fat. Visceral fat poses an issue because visceral fat is the fat over the viscera, and it infiltrates different organs. And that is the one that is most damaging metabolically. It's not the pinch and inch, the little thing that you see on the side hanging over. It's that visceral fat. And the visceral fat, believe it or not, communicates through interleukin beta, through the brain barrier, and damages your brain. So essentially, your visceral fat poses a major issue. Your blood sugar poses a major issue. Dr. Mark Hyman coined this in 2012. He called it diabesity. Facebook user, what remedies would you use for help to decrease the potential side effects of the new vaccine? Homeopathic and herbal vitamins before the vaccine, after positive. Great question. Let's talk about the vaccine. There's 3 types of people. Number 1, there's those who haven't gotten anything. Number 2, there are those who already had COVID. And number 3, there are those who have the vaccines. And let's point right now, even though Johnson & Johnson just got last night FDA clearance, let's just talk about the ones that are out there with the mRNA. So let's look at the question again, the side effects of the potential side effects of the new vaccine. Interesting, because I had a question about autoimmunity, which is one of the side effects of COVID and one of the control considerations with the vaccine, but it appears that it's a much less of a consideration. So some of the things that I would recommend is keep your immune system strong. You can't control the virus. You can't control the vaccine, but you can control the host. And the best way to control the host is to take care of the host and make the suggestions. Food is a critical element. Food is information. Food can be a creator of inflammation. Body's all interconnected. That information, that communication is critical. You are what you eat. You are what your food ate. You are what your food has been sprayed with. So you want to eat good, wholesome, organic, non-chemical foods. Those are a great choice. Start with that. Get a good night's sleep, 7 to 8 hours of good sleep. Exercise every day if you can, about 30 minutes. Have your stress reduction. And then the aforementioned nutrients that I recommended before would be a great choice. Now, if you've taken the vaccine and you have that 28-day or 21 to 28-day span, here's what you want to do. Dr. Work, who's on there, he's an expert in biotics. Want to make sure to flourish people's guts with good bacteria because it's a critical element. You're going to see some questions that people ask me about the gut and gut health. 80% of your immune cells are in your gut. You're seeing virtually everybody now have some sort of GI distraction or GI upset. One of my patients just called me up and he said, I've had COVID for the last 5 days. I said, watch the GI. Day 6, called me up. He goes, yep, it hit. Secretariat run to the bathroom. Okay, I have another question over here. It's a great question. I don't want to change topics, but I just give a break from COVID for 1 second. Somebody said, what's the difference between grass-fed and grass-finished? Well, grass-finished means the cattle received grass or forage diet their entire lives. They've eaten nothing but grass. They finished their life eating grass from beginning to end. Grass-fed means that they ate grass, clearly, but it's very conceivable in the last 6 weeks, they were fed grains, soy, and corn to make them bigger, so the meat weighed more. So you want grass-fed, grass-finished. If they said they grass-feed it, you want to make sure they grass-fed it all the way to their termination, if you will. Pasture-raised, it means it grew up on a pasture. It means nothing else. So you're looking for grass-finished. That's what you're most looking for. One more question before we get back into the COVID, and we'll still see some questions flying in. They've been trained with the calories in, calories out, macronutrients in, count the macronutrients. And for me, I don't count calories. I count chemicals. I don't count calories. I count satiety. Well, I wanted to answer this. You see the book right here? This book's over 100 years old. The book is by Lulu Hunt Peters. She was an MD, and it was a staple. It's 100 years old. No, I wasn't around then. No, neither was my parents or anything. But there's still copies of this book. And she was revered. It was the first book on weight loss. It was outstanding. She had lost weight by cutting calories. We are following this book when you talk about macronutrients and micronutrients and calories and things of that nature. So that was written in 1919. It was right after World War I, where she talked about the idea if you eat less, you need to be thin. If you don't eat less, you're taking food from your children and things like that. It was very cutting edge at that time, but we've evolved over the last century. So calories matter, but they're sort of at the bottom of the importance of the pyramid. It's more about what they do for you, what comes with it, because clearly if I had a brustling amount of broccoli versus a frappuccino, I'd have to eat a lot of broccoli to get to the calories. Again, it's not all about calories. It's about chemicals. It's about nutrients. It's about value. It's about what information it provides you. So the other question is, they've read a lot. They've heard me say it, but they've also read a lot. They want to know some information about autoimmunity. How prevalent is the autoimmunity in COVID? And what's my projection for immunity with Dr. Work? My pleasure. I appreciate your little shout out for my time and diverse expertise. I do appreciate that. So we're going to dig right in here. And let's talk a little bit about the development of autoimmune diseases following SARS-CoV-2 infection. Number one, if you're genetically susceptible, you're going to have a higher incidence. Essentially, Most people who have aberrant immune system, and that's the problem. People say, I'm okay. I'll be okay if I get it. Well, how do you know? Yes, if you lead a good chiropractic lifestyle, lead a good lifestyle, etc. But how do you know? Have you tested your immune system? Typically, the autoimmunity comes from a hyperstimulation of the immune system, something they call molecular mimicry. So what happens is something gets into your blood system. Your blood, it decides is it self or a foreign. If it's self, it doesn't do anything. If it's a foreign object, like a food, a virus, a bacteria that it hasn't seen before, like a novel virus, the immune system attacks it. You get localized inflammation. Ultimately, if it's floating around in your blood system, doesn't get ameliorated right at that point, you have systemic inflammation. And then when your immune system becomes aberrant, hyperstimulation, you get something called molecular mimicry. Molecular mimicry means the molecules mimic what they call protein sequence, which is your number, just like other body parts. And then you attack those body parts. You get a cytokine storm, you get a fever, and you get autoantibody production, ultimately leading you to autoimmune diseases and severe disease. Now, there was a great study that Dr. Datish Karazian and Dr. Risto Wujijani did back in August, where they talked about 42% of people that they tested for were getting autoimmunity with these antibodies. They had a follow-up study in January, and they talked about immune reaction to the gut, skin, nervous system, brain, thyroid, joint, muscle, and different cellular components. So there is a distinct possible relationship between SARS-CoV-2 proteins and autoimmune target proteins. Autoimmune-like antibody responses are linked to COVID-19. Remember, an autoimmune disease is a self-destruction. So you want to avoid autoimmune disease. Your B cells, which we talked about before, have to undergo a proper training process. Those that respond to the virus will find their antibodies capable of disabling this invader. B cells that target your own tissue should be destroyed because you don't want to eat up yourself. You don't want to attack yourself. By the way, what's a classic example of autoimmunity? Most people say rheumatoid arthritis, and that is correct. Others, something like thyroid, just a little further, the maturation process takes time of the B cells. So if you have an antibody response that's needed quick, where the B cells have to help your T cells, you're going to form an alternate form of B cells, and they're going to come from what we call the extrafollicular phase or the extrafollicular activation. When COVID-19 shifts from B cell activation in what we call the germinal cells within lymph node follicles to extrafollicular B cell activation. So the critical element is that if B cells come from the extrafollicular area and not the germinal cells, not to get too technical, if they're immature and they come too quick, you have a higher incidence of autoimmunity. So that poses a major issue. And that is really your question. That is really your answer. Yes, it is truly common. And the last question is, people asked, how can I get in touch with you? You know it right here. I'm here for everybody. I'm here for you. Appreciate all your time. I appreciate you guys sending questions in. If you ever have any more and you're seeing it on Memorex and can't catch it live, I'll be happy to answer it. Dr. Rob Silverman, always yours now.